That's it. You're good to go.
Wonderful, that's great. Thank you very much. Okay, so I'm currently a part-time research student at Plymouth University, and I'm working full-time. I work as an environmental health officer at a council in Devon, which is really exciting. I've been here since 2007, and the work is remarkable. It's really varied. So I work in private sector housing, so I enforce the Housing Act in privately rented and privately owned homes. So I don't touch council stock. And a lot of people are quite surprised that people like us, we exist. So today I'm going to do a background to the study, what's motivated me to do it, why it's relevant to the work that I'm doing, and also why it's relevant right now. And I think a lot of us are aware of the mood and events of recent years. So I'm going to look at the aims and objectives of the study. I'll go through the methodology, why I've decided to do it in a particular way. The work hasn't been published, so I have to be a little bit conservative as far as results are concerned, but I have got some interesting graphs to show you. And then I'm just going to have a very brief conclusion and let you know what I'm hoping to do next. So, enforcing the Housing Act, I use something called operating guidance, which tells me that there are 29 hazards in an average home. These are typically homes that have been built for many years and don't comply with building regulations. So most of my work focuses on the established stock, and we've got so much of it. And our stock is amongst the oldest in Europe. So some of the hazards that I come across are excess cold. So the top left in this particular slide is a really good example of supplementary heating that this particular family have had to use because their own heating either doesn't work or is not efficient. So with cases like these, we often find we also need to insulate the property to reduce the amount of heat escaping through the walls and the loft. And this particular case, we had grants because of government schemes, and they were able to get gas central heating put in. So it was a really good result. The next one across is an example of a poorly converted building. We get quite a few of these, where they haven't gone through building control and they haven't complied with the regulations. So here we have a property that's really cramped. You can't stand up in the bedroom. There's no insulation, and the means of escape would have been down the stairs and through the living room and the kitchen. Both are high-risk rooms and more likely to be the source of the fire. So with this case, we were able to rehouse the tenant, and we got the landlord to do the work that he needed to do to bring it back into use. So a very good result, nice little property. Bottom left, very common, we come across electrical hazards a lot of the time. There's been new legislation produced which requires landlords now to have a satisfactory electrical certificate, and they must then maintain that standard throughout the time of the tenancy and have a new certificate done every 5 years. So with cases like this, we may isolate the supply just in that area. So for example, close the room whilst the landlord gets the electrician in. We do have powers to do emergency remedial action when we recharge the owner. It's really interesting work because this area is particularly difficult. It's tenant-led, which means that tenants have to make sure they've got electrical safety certificates before they start a tenancy. Then we have falls on stairs. This is a really common thing, and we find quite a few properties have actually been built in the past without guarding. In this case, they were using the lack of the guarding to get their furniture up the stairs because it's quite a tight little quarter turn. So we got the owner to put in a proper guard, which was removable. So when it comes to health and safety, it's not necessarily we have to eliminate the risks. What we try to do is get people to live with them so that they can manage whatever they've got to live with. This bottom right is a really good case in point. This is a shower that was installed in another poorly converted flat. That's the technical term. and there was no window, there was no extraction. So there was obviously going to be a condensation issue. With this one, we negotiated with the landlord for him to move it to a different part of the flat. So that was good. We don't put properties out of use often. So this slide shows that in 2015, excess cold and falls on stairs were the most common hazards encountered in our stock. Excess cold has been our main focus for many years. We've participated in many schemes run by electrical companies, energy companies. And one of my first jobs when I got here was to enter the carnival to promote something called warm zones. That was a very long time ago. So excess cold for us has been our leading cause of death. And as we've done this work on homes, we've insulated the walls and so on, we can see that there's been an increase in thermal efficiency, which is measured by standard assessment procedure. So it's, you come out with what's called an energy performance certificate, and that tells you how good the property is at keeping the heat in and so on. And every year, the government launches its survey, its English house survey, and it monitors how we're progressing across England. And here we can see that there's been an increase in mean SAP rating every year since 1996, which is really encouraging. This is really good for us. In theory, we should have a reduction in the number of deaths that we see each year in winter, known as excess winter deaths. This is good. In the same report, headline report in 2019 to 2020, they also reported a good reduction in the number of damp and mouldy homes. If you have good heating and good insulation, you can manage moisture better in the homes and you get less condensation. So it's all very good. And because we've got such a large number of empty home, established stock, a lot of them are old and they don't have the level of insulation and heating to enable them to cope with damp and mold. So excess winter deaths in the same report has been showing a downward trend generally, but it doesn't really correspond with the SAP ratings or the reduction in damp and mold. And in 2017 to 18, there was a blip and there was a sudden increase, which is really unusual. So are excess winter deaths really linked to SAP rating? Or are they linked to SAP rating in a way that we hadn't anticipated? So these are really excellent questions, and this is what set me thinking. In 2019, Richard Sharp wrote a fabulous paper. He looked at the work that we've been doing in Devon. He linked it to property efficiency, and he looked at hospital admissions at the local hospitals. He was predominantly looking for asthma, and he found that energy efficiency ratings were associated with a small but statistically significant increase in hospital admission rates. This was really disturbing for me because we'd been putting all our energy into energy efficiency. And if what we were producing was in fact more illness, then clearly there was something wrong. So excess winter deaths. So this is an example of what they look like. This young lad, we all know, I'm sure, spent all of his life in a progressively mouldy environment. Because of his age, he probably spent a lot of his time there. And at his death, the coroner noted that there was no window in the bathroom, so no ventilation. The fan in the bathroom didn't work effectively, so management by the landlord, not brilliant. The window in the kitchen opened onto the communal walkway, and that may have been that there was a lack of movement of air, or it could have been the window couldn't be opened because people would walk into it. I wasn't really sure on that one. And then the last one, there was no evidence that up-to-date relevant health information was easily accessible to the housing sector. And this, I think, refers to category, hazard number 1, which is damp and mold. And it's right. The housing assessments that we use are based on very old data. It was created back in the early 2000s, and it hasn't really been updated since. It's being updated now, which is really good, and it's encouraging, and we're all waiting to see what the differences are. This is another example of an excess winter death. It's this last, you may recall, Ella. She was 9 years old when she died in 2013. She'd spent her life in London. When she passed, she was living in Lewisham, which is an area of really high traffic pollution. And her passing was a significant event because this is the first death that was attributed to air pollution, and this is a global first. And the coroner pointed out that traffic emissions, for example, nitrogen dioxide, were above the EU and domestic limits. So Professor Sir Stephen Holgate gave expert evidence to this inquiry, and he pointed out that traffic emissions, yes, pollution is outside, but it's also inside. And this is leading me down towards the reasons for this study. So this diagram is from the Energy Savings Trust, and we can see there are 16 pathways of air leaving a property. So through gaps and cracks in the construction, particularly old stock, windows, window frames, through services, and so on. And as we change properties, as we insulate them, we reduce those pathways. So it makes sense that there will be a reduction in air movement, both in and out. But we can see how traffic pollution can enter the home. It'll also come in through the open windows in the summer. And the importance of air pollution, both indoors and out, is summed up here with the Royal College of Physicians diagram, where we can see that even in the womb, the fetus will be being affected by air pollution, by whatever the mother is breathing in, because air does go through the alveoli, it goes in through the air sacs and into the bloodstream. It's just, that's what it does. As children get older, then we see there's more likelihood of wheezing and developmental problems. Then they approach the 7 and 8 years old, and they start to acquire asthma if they're in the presence of respiratory irritants and allergens. And then we see the start of atherosclerosis, which sets the adult up for heart disease. And we can see that coming in as we move towards the right-hand side. Then we see type 2 diabetes, heart attacks, all the things that we were hoping to avoid by improving on excess cold. And then towards the end, we have poor cognition, and Alzheimer's has now been linked to particulate matter, PM 2.5. So this diagram by Sophia et al, it's quite nice because it shows you the pollutants and their destiny and associated symptoms. So nitrogen dioxide, which we get from burning fossil fuels, so for example, gas, can result in headaches. There may be some crossover with other pollutants, for example, carbon monoxide, which can have a similar effect. We've got asthma. So what we see here is more an indication of the indoor pollution that we can see. Now, the 29 hazards that I talked about in the operating guidance, when I go to a home, this is the list. And I'm showing you this because biocides, carbon monoxide, nitrogen dioxide, smoke, SO2, the highlighted hazards are there, but we don't actually know how to measure them. how to quantify the risk. Is there a risk? What am I looking for? So when I look at all the data over the years, I think the only ones we've really used is carbon monoxide and smoke. Oh, and there was a gas leak once. So it's actually really rare that we would use these. And I wanted to know why. What should I be looking for? So all through my working life, I've been looking at knowing my enemy. So knowing the path of diseases, how to treat people, how frequently you should change dressings, how much fluid. I worked with Cyanamid, which is a crop protection company, and that was definitely know your enemy, know what you're trying to kill. But with air quality, it's not visible. It is a source of problems, of symptoms and allergies, and the risk is not clear. We don't know what people's exposures are, how they're created. It can't be measured, and because of that, we can't manage the risk. At the same time, we don't have a methodology. Several papers have pointed to the same issue. There is no method for monitoring indoor air quality. And at the end of all of this, when we do finally work out what the issues are, we will need to know how to deliver this information. What do we tell people? How do we know? So I had a good old scout around and I realized that a lot of these things are in my home. So cooking is a very rich source of particulate matter, depending on what you cook and how you cook it. So, for example, frying meat brings up an awful lot more particulates than steaming, for example. Cleaning sprays, personal products, perfumes, air fresheners, everything that we find in the home all adds to the burden. Paints, we've mentioned those before. VOCs now have been reduced in many paints, but there's still considerable risk, and there's still very old, empty, low pots of paint amongst landlord stock. It's quite surprising. The bottom one looks like nitrogen dioxide. I couldn't have told you that when I started the study, but I know that now. And then we've got the wood-burning stoves, which are obviously increasing in popularity, and it's obviously a great source of news at the moment. And then showers, steam, humidity. All these things contribute to our internal environment. So I aimed to examine this relationship between housing typography, occupiers' behaviours, what we contribute to our air quality, and how it influenced our air quality. I wanted to assess behaviours of the products that people would bring in, how long they would use them for. I wanted to find property data, so I could look at construction types, insulation, ventilation, all these things that also affect the amount of air coming and going. I wanted to find out the geographical elements. So, for example, if somebody lives in an area that's quite shaded, that they may not have good throughput of ventilation. I needed to measure what was in people's homes because really there's very little literature out there at the moment, which I'll show you in a moment. So I decided to look at nitrogen dioxide, carbon monoxide, carbon dioxide, formaldehyde, nitric oxide, and particulate matter of various sizes, and of course temperature and relative humidity. And then I would undertake an analysis of all of this data and see what comes out. So the survey was rather long. It was 40 questions. It was extensive and it was quite involved. And anybody that got to the end of it really deserved a medal. I got fed up with it doing it. Linking the property data, the council has access to property data, which tells us about the age and construction. But I also wanted to download the latest Energy Performance Certificate Register, which is publicly available. And there's probably about 60,000 energy performance certificates in our area. So that was good. Yeah, sampling in a number of homes. So when people have filled in their survey, they were given the option of, do you want to have some sampling? And over 50% said yes, which is really encouraging. And then some mapping. I learned to map many years ago in one of my degrees, and I absolutely love it. It's exciting. So I've mentioned the survey. So methods of ventilation, how often do people open their windows? How long? Is it overnight? Have they got damp and mold? Is it extensive? Is it small? Is it in the bedroom? What sort of chemicals did they use? I listed about a dozen of cleaning, personal care, and air fresheners. And I asked how frequently they were used and for how long, and recent renovation and so on. And the most important part was the postcode and the house number, so I could find their property. So in practice, the survey, oh, that was tough. It was web-based initially, and I got 140 responses, and then it went completely silent. It was really dragging. So I did door knocking. Now, I work full-time as an EHO, which takes me out onto the district inspecting homes. So I was able to finish my job and then dish out surveys. And I worked out I could do 25 to 30 in an hour. And then I'd go back the next day, either on another job or in my own time, and pick them all up. And the key was to note the property where I'd left the survey, and I'd spoken to the person, explain what I was doing. They'd agreed to fill it in. They would put it into an envelope and leave it for me. And I would come by, knock on the door, pick it up from them, and I would note down the address, the number. And then when I got home, I put them straight into the survey. So as far as quality assurance is concerned, it was quite a lot better than if I had just left surveys with people. It was a lot of work. But what I found was that personal approach of explaining what I was hoping to achieve and answering any questions, my response rate was phenomenal. It's really good. And we can see here, so at the top, July to December in 2021, that was approximately 140 surveys. But in the yellow, this was when I was going out on district. And in April, there was a sharp decline. It went down to 39 because I was rather tired. So I took a break. And then in June, I did the same, and I concluded I had enough. It was fine. I had plenty. The energy performance data was really good. It told me about the built form and the type, the depth of insulation, fuel sources. This was also asked in the survey, but I wanted to have a look to see if there was any major difference. And also proximity to outdoor pollution sources. This data can be mapped, which is really useful. The disadvantage is that I could have a F-rated property today with an EPC of F, and I could insulate it all tomorrow, but I'm not required to have a new EPC. It's not included in the law. So it means a lot of our data is potentially out of date. But it was good. It downloads into Excel spreadsheets, so it can be worked with. The sampling, this was great. I needed to work out what parameters people had been sampling. What was the hot topic, really? So I did a literature review, and I found that the most common was particulate matter, so 2.5 particularly, volatile organic compounds, formaldehyde, and carbon dioxide. Now, carbon dioxide is typically used to illustrate the amount of ventilation a property. So as we breathe out carbon dioxide, it gets diluted and it goes away. So if you open the window, it'll go away quickly. So it's often used as an indicator. So that was on the list anyway. I think the formaldehyde, I couldn't do VOCs because the equipment, it required active sampling, which I didn't want to do. I didn't want to be hanging around, and I didn't want it to be noisy. So formaldehyde was on the list, and particulate matter. And if I could do more than one, well and good. But I noticed that nitrogen dioxide was a little bit lacking, carbon monoxide too, and the other parameters that I couldn't find any equipment that I could use, so for benzene, toluene, and so on. They've been done. I also did a review of health research and whether there was a mention of pollution in their papers, and there was quite a few. But what I found to be lacking was the going out and ground truthing, actually finding out what was in people's homes. So it was always been a case of trying to get cause and effect in one paper, and that's quite rare. I had a look at sampling guidance, and there's quite a bit of that, but it doesn't really cater for established stock. So for me going in as a housing officer, it doesn't help me to know what equipment to use, where to put it. There are principles in all of these papers, and I refer to these during the sampling because I think this is important. The equipment, I did a review of equipment. I didn't want to do passive sampling because that gives you a concentration over a period of time. And really what I wanted was to see peaks. You know, what are people being exposed to? What is the extreme potentially? So for me, it had to be real time. I bought a Yoo-hoo air quality monitor, very small piece of kit, reasonably priced, hooks onto the Wi-Fi, and for a fee you can get downloadable data. But then you have that complication of trying to hook onto somebody else's Wi-Fi, and if it's a 2.5 gigahertz piece of equipment and they can't get that, then you can't go to that property. And I didn't want to waste the time, really. Raspberry Pi, I built a small unit for particulates. It was okay, but the prospect of having to do so much soldering and building, and also the prospect of it not being very good because of my poor soldering, my quality control. So I abandoned that. Ideally, I would have liked a grey wolf because it's all singing or dancing. It's incredibly well built. It's calibrated. It's got a whole load of parameters, but devilishly expensive. Similar with the AQ Expert, it can monitor a whole load of parameters, which was great. But again, cost was prohibitive. And it's the same with dust track aerosol monitors. There are cheaper versions of equipment, but they weren't really what I wanted. I did some research on how long to sample for. Some people were sampling for several weeks, others for a few hours. But the consensus that I favoured was 24 hours because that suited my work life better. It would give a full 24-hour period for every event. So if a pollution event happened, you could see how it would tail off, and I liked that. So the consensus was 24 hours. Singer was slightly different. They did a 30-minute sampling period for nitrogen dioxide. They did a co-location study, so they had 2 different types. The frequency of the actual sample was 60 seconds. That looked like it was the absolute, it was a requirement for 60 seconds to get the sort of accuracy that you're looking for. So this helped me hone down the equipment, which I can't go into, but at this stage, because I haven't published the work, but there are 2 pieces of equipment that I used. They complemented each other very well. They were both downloadable into Excel, and it seemed like a really sensible option, and they were just about affordable. So the next hurdle was working out the location. Quite a few papers had focused on kitchens and cooking. I didn't want to be doing that because if I was going to do this for 24 hours, could I leave equipment in someone's kitchen for that length of time? You have to think about room sizes and so on. I didn't want to do bedrooms particularly. I didn't think that I'd get a really good spread of pollutants up there. I'd like to have done both, two locations. That would have been ideal, but I just couldn't afford the equipment. So I settled on this area, which is living rooms. I had to be mindful of heat and pollution sources. Furniture can alter particulate matter and how it moves around. Height from the floor. There were various papers. Somebody hung some equipment from the center of a room, which was an interesting approach. Others were mounting equipment at a meter, so you would get, say, small children and what they were exposed to. But in the guidance that I read, and quite a few papers, they were looking at about 1 to 1.5 meters. So that's where I settled. I had to work out how to mount the equipment onto a tripod. That was fun. I've got a friend who's a photographer, and he's incredible. So we set it up so that I could put it together really quickly and take it apart within 5 minutes. I could put it into a storage case, so a flight case that I got from Wilko. I could strap it to the back of a motorcycle because I don't take my car everywhere. It was just such a really good setup. The equipment I got was mains powered, but I could operate one of them on a power pack, which I had done a few times. But I wasn't certain that I was able to use everybody's electricity. I didn't want to put the onus on other people, and if their power supply went down. So I bought a power pack from Halfords. It's £80, and it's got a 3-pin plug, so I could plug everything into there. And I knew that it would just be all self-contained. If it went wrong, it was my fault. And it did. Distance from the walls, obviously that was a factor in quite a few papers. And then locating it so that people could see their TVs and their pets and their children wouldn't be damaged or wouldn't damage the equipment. And the last thing is I had to remind people if they wanted to have a look at what was being measured, hold your breath. So to want to measure their breath, I did that a few times myself. So there's the summary of the sampling. Quite an interesting selection. So the initial results were really good. I got back 728 surveys. They were all complete because I couldn't put them on the system unless they were. I had to go back to a few properties. That was not a problem. Matching the property data, I managed 657. The ones I couldn't match were outside of the local authority where I work, so I wasn't able to get those, which was a bit of a shame. I matched up 400 energy performance certificates. I had to keep trawling through the list to see if I could get more, because as people buy and sell their homes, more were becoming available, so I had to revise that a few times. Sampling, I did sample in 54 homes. I had 3 equipment failures, so I've got 3 incomplete sets, so 51 complete. So I was really pleased with that. The survey, this is just one example of some of the output. So this one is, do you have plans to improve the air quality in your home? So this is more sort of attitudinal sort of awareness, and just to get an idea of, does indoor air quality exist with other people? Is it a thing? So quite a few tended to agree with this sort of thing. I have more data on this, which I can't show just at the moment. This is some of the responses to heating. So I asked what sort of heating and for how long would they run it. So this is all through the winter. This is very important. So it was quite surprising that I would have expected more people to heat for longer, but 3 to 6 hours looked like it was the most popular. And surface cleans, on this one I've put this in. So this is one of the products I was looking at. So surface cleaners in spray form was the question. So I got the frequency and for how long they would use the product for. Very interesting. Damp problems with property age. So this is some of the linked data. And we can see here that properties built between 1967 to 1982 seem to have more issues with damp and mold. I've done this through the seasons, so as you can see that the red, it may be winter, maybe summer, and so on. And we can see that some properties do have issues all year round. But it also shows that damp problems, which we had always assumed were, oh, it's in the remit of the old properties, it's the old ones that get it. They do, but so do the more recent properties, and even a post-1996 property reported problems. So it does show that there is more than one cause for damp and mold, which we know. Damp problems with energy efficiency and the EPC data. So again, it looks like the focus is in the D-rated properties. So that's just, I'm just going to park there, but I think that's quite an interesting observation. With room use, I'd anticipated bathrooms and then kitchens being quite damp and mouldy, but it looks like bedrooms have topped it here. So I haven't got the detail on this. I'll be looking at this in more detail. Respiratory symptoms, I had asked for the person filling in the survey to say whether they had a whole range of these symptoms. There were 29 in all. But I also wanted to capture whether the partners and the children had an issue, because often if one hasn't got it but the partner has, you would miss that data. We can see we've got some interesting results here, quite a small stack on children. The number of children reported in the surveys, householders reporting that they had children, was actually quite small. So that's quite interesting. Okay, so this is some of the sampling results. This one was incense. I've taken off the detail of how high this was, but the amount of particulate matter in the whole range was wonderful. It skewed my results somewhat, but it was really good to see. This householder lit an incense stick every night. This is another way of looking at particulates. This is over time. This is starting at 9 o'clock in the morning on the left, and we can see that particulates of the different sizes, more or less in communion, working together. Then it drops down, and then we have another spike in the evening. This could be a cooking event. And then we can see how it gradually trails off over the early hours of the morning. Now, in terms of exposure, that's not so important because we assume that people go to bed at about 10 or 11 o'clock at night. But I think the concentration is of interest, and how it tails off overnight, and are there circumstances where it doesn't tail off as much. This one was an interesting pattern. So it starts off relatively low at 10 o'clock in the morning on the left, and throughout the day we can see there's a peak at around about 6 o'clock. Again, this could be a cooking or a heating pattern, and then we have a continued concentration in through the early hours. A different way of that same data is we can see that the spike is between 10 and 11, so it's a very short spike of particulate matter, and then we have something corresponding at 9 o'clock in the evening. This does look like a heating pattern. So the initial findings. So some properties had very little in terms of chemical components. In fact, a very, very small percentage had very little. Nobody knew that they were surrounded by gases and particulates. There's no way of telling. And approximately half the homes sampled had wood-burning stoves. It's obviously a very hot topic at the moment, and they were very happy to have some sampling done. One home that I went to had a really strong odor of heating oil in the kitchen. They had become immune to it. They didn't even notice it. So that's another really important aspect of this work. Some households used a lot of cleaning products and some used all of them. for long periods. Damp and mold, as I've mentioned earlier, may not be related to property age. I think there are a lot of facets to damp and mold, and allergic symptoms are certainly associated with certain household products. In terms of the profession, I think this is really, really interesting. I've learned an awful lot about air quality and about people's attitudes towards it. What I found is they are so positive and welcoming. They are very keen to know about air quality, and I think the recent cases have fueled that. So indoor air quality is definitely a determinant of health. The use of chemicals in homes, we know, can cause allergic symptoms, and some of the responses that I've had would indicate that, would support that. Exposure times are important, but I also think it's the concentration of the product. I tried a particular cleaning product in a small bathroom, and within half an hour I was sneezing, my eyes were running. So we don't know which chemicals necessarily are responsible for the symptoms that we get, but the more we do this sort of work, the more we'll find out. A more comprehensive assessment is needed for our work. At the moment, we're dealing with damp and mold because it's the time of year, but there are other things that we really should be looking at. And for my profession particularly, whilst medical intervention is important, it's important that we treat asthma and go through the causes medically. We also should be looking at the environment to see if we can identify some of the triggers that may exacerbate an attack, or maybe some of the chemicals that have potentially caused the reactions in the first place. And what I've tried to do for many years is to work more with healthcare professionals. The coroner of AWAB's inquest noted that although health visitors were going to the property and they saw all the mold, they reported it to their managers, and really they should have been reporting it to the housing sector, because we are the people that can do something about it. And that wasn't a private rental, it wasn't a privately owned property, it was a housing association, but it still applies to the private sector. So for me, the next stage is writing up and publishing results. There's a lot of work to do. I'm planning to develop the methodologies I've used because I think it does have some merit. I would like to get it ratified or endorsed, I think, by my peers. That'd be useful. I would like to develop risk profiles for the chemicals used in the home. That work is underway at the moment. I want to do some additional sampling, maybe using different equipment. I'd like to do a co-location study. I think that's what you'd call it. So get some industry standard equipment with something that we could use in the home or the local authority could use to see if there's parity. And ventilation, what works? What can we tell people? Is 5 minutes of purge ventilation enough? Should be. How long do you leave extract ventilation running before you know that the levels in your home have come back down to satisfactory concentration? So there is a lot to do, and I'm very excited. Thanks.